will just look at the summaries to see, what actually came up. So they kind of categorize it or organize it a bit, which is handy and lets us go over things a little bit faster. It's nice to see this section though, I think, because it gives us a better sense of like all the different antigens that are tested for, and it also gives us a better sense of, to what extent are any positive findings, like any, non-control findings actually relevant. So, for example, here in this demyelination antigen section, there's the 6 different antigens that they test for. We can see that only one of them has come up positive, and it's quite mild at that. So overall, it does not look like this patient is dealing with, in my opinion, is not dealing with significant amounts of demyelination. So we're probably not overly concerned about, the integrity of their myelin sheath. As a point of reference, myelin is the essentially the sheath or the insulation that goes around many of our nerves, and that insulation allows for more efficient conduction of electricity down those nerves. So just like if you had a wire in your home, there's an insulation around it so that the electricity is not just flying off into the ether. You want it to not, set off sparks and set your house on fire, but then you also want it to travel nice and efficiently from, one end of the wire to the next, so that your light switch turns on or your laptop charges or whatever it is that you're working with. So with myelin, if there's a degeneration or degradation of the myelin, then that's going to lead to a compromise of the nervous system function. And the classic example of that would be multiple sclerosis, where there's an attack on the myelin sheath. So in this particular case, we can kind of look at this. So if we were just looking at the summary section, we saw like, oh, that anti-myelin proteolipid peptide, like that came back as, something came back there. It's like, oh, maybe I've got some demyelination going on. When we look at this in context with all these other demyelination antigens, like, well, maybe that's actually not such a big deal. And before moving on with this report, just looking in the top right corner there, let's just quickly talk about what the relevance is of these various numbers. So as you can see there, the reference range section in the top right corner. So green is generally good. Rare to see a report where green is bad. It's kind of funny because if you're feeling green, you're feeling sick. But anyways, it's all relative, or it's all contextual, I guess. So the green means in control. So any number that's less than or equal to 10 would be green, or any of the numbers that come up black are within the control. Moderate would be 10.1 to 2, or yellowish orange. And then anything above 20 would be red or in a risk category. So the reason that they frame it like this or phrase it like this is that because you might think like, okay, these are autoimmune antibodies, or antibodies against tubulin and myelin and these different things that are coming up or that are listed here. So wouldn't any number be bad or problematic? Like, should we not have 0 of all of these different antibodies? And that's a really great logical question. But the answer is no. It is acceptable or normal to expect low levels of these antibodies in healthy folks. And we have sort of a comparator for that with just more standard labs. For example, if one was to go to, see their family doctor or nurse practitioner, naturopathic doctor, whoever, and like just get standard, say, anti-thyroid antibody labs, there's a reference range. So the range depends on the lab, depends on the marker. But say for anti-thyroid globulin antibodies, one of the labs we use, the reference range it's supposed to be less than 115. And if you're less than 115, that's considered normal. So in other words, when they do the test on healthy control subjects who have no thyroid issues whatsoever, their thyroid looks to be as healthy as possible by all measures. It's normal to have, say, like an 80, a 50, a 30, 114. That's all considered normal for anti-thyroid globulin antibodies. So it seems kind of counterintuitive that a perfectly healthy person would be walking around with these antibodies that are geared at attacking the thyroid, but that's the way it works. Now, do the patients actually have those antibody levels, or is it more that the assay, the testing reagents are maybe cross-reacting with other things? And like these are details that I do not know the answer to, and because I don't know that that's been thoroughly explored, because I don't know how you would actually determine that in a at least in human controls, or in human subjects. But it is the punchline is that it is normal, it is expected for healthy controls to have very low levels of these, like relatively speaking, low levels of these antibodies. So just in case anyone was wondering, that's why 0 is not considered to be the normal baseline. Anything less than 10. So moderate being between 10.1 and 20. So they're saying moderate, like, well, what's moderate? Well, they're referring there to say like moderate risk, or moderate possibility that this is causing a problem. So with these, many of these antibodies, when you do a deep dive into looking at what the research literature says about these antibodies, for a lot of them, they are either have not been studied outside of an animal model, just saying that like, oh, we had an animal model of MS, and we found anti-tubulin antibodies in 30% of them or something like that, or maybe there are some human trials that have been done, or human studies that have been done, saying we took blood samples on 100 patients with Parkinson's, and we found anti-dopamine receptor antibodies, but we don't yet know what the definitive clinical relevance is of that. So with this test, like with the NeuralZoomer Plus, now and then there are some markers that they test for that have been very well studied. So with the NeuralZoomer Plus, there are it's the way I sort of the way I conceptualize it is that they're casting a very broad net. They are looking at really, I think, all of the possible markers that they can test for. They're looking to see, what are the levels of those antibodies, whether IgG, IgA, or IgM, and then presenting that data. And then it's up to us as functional medicine practitioners to figure out what that means. What's the clinical relevance of that? And then also being able to track that data over time. So, for example, if I had a patient who had symptoms that looked very much like MS, yet they have an MRI, their MRI comes back looking normal. They say have a lumbar puncture / spinal tap. That result comes back looking normal. The neurologist says like, it looks like MS, but like we're really not sure. We're just going to monitor you for a while. Say the patient's having, just some episodic symptoms or maybe some mild symptoms. They're just kind of monitoring. Well, this might be a very appropriate time to run a NeuralZoomer Plus test. Again, not giving medical advice, just talking anecdotally here or just talking academically. But this might be a really great time to run a NeuralZoomer Plus test in a patient like that to see what comes up. And if this demyelination section comes up, lighting up like a Christmas tree, or maybe not like a Christmas tree, but if we saw a bunch of orange in the IgG, IgA, or IgM section, say like, well, that's not super high levels, but we really shouldn't be we probably shouldn't be seeing those demyelination antigens. So for example, this patient has a diagnosis of Parkinson's disease. So Parkinson's, being a loss of dopaminergic nergens in the substantia nigra region of the brain, and nothing really directly to do with demyelination at all. And so with him, even though his symptoms have, progressed to a certain point, and thankfully is, doing quite a lot better clinically with treatment, which has been great. Despite that fact, despite the fact that there is this neurodegenerative picture, like his demyelination antigens really look very uneventful. Almost everything is black. There's just a very low moderate there at an 11.8. So if there was, say, a person who's, say she's in her 30s, she's having some classic symptoms of MS, this all the MRI and everything looks normal. And then she comes back with, say, a bunch of like 15s or 18s, or, maybe some low 20s in the demyelination section. I'd be thinking like, this is probably really relevant. This test is probably, it seems to be picking something up that, the MRI hasn't quite caught up with yet. There hasn't been enough damage yet or demyelination to actually pick up those white matter lesions on the brain or on the MRI. But this test could be really useful in a case like that. And then where it would be further useful, in my opinion, or in a scenario like that, would be that with treatment, so let's say we started on some anti-inflammatories, some immunomodulators, some things to help support the function and integrity of myelin, or the synthesis of myelin, etc. Then she's like, hey, I'm feeling better. Well, I wonder how my brain's doing. Well, the MRI is not going to be helpful in that case because it didn't show any problem in the first place. So a follow-up MRI could, of course, show whether or not things had progressed despite her feeling better in this hypothetical scenario. But you're not going to use a follow-up MRI to track progress because it already looked good in the first place. She's not going to go in for a follow-up spinal tap because everything looked good in the first place, and they don't follow up with spinal taps anyways for tracking progress. Very invasive, and try to minimize those as much as possible. But doing another NeuralZoomer Plus could be really useful. In my opinion, likely would be very useful in a case like that because we can see, hey, are these antibody levels coming down? And I know if it were me, if I had those, MS-like symptoms, I would be wanting to treat until my NeuralZoomer Plus looked 100% because I would not want those antibodies to be present at all in my system. So that is the backdrop for the NeuralZoomer Plus. I will now move through the markers here for this particular patient and give you a better sense of all the things that are tested for. So with the so the first section here is the demyelination antigens, as already discussed. The next section here is looking at blood-brain barrier disruption. So the blood-brain barrier, as I'm sure everybody knows, is that junction between the bloodstream and the cerebral spinal fluid, the fluid that bathes the brain and spinal cord, the central nervous system. What folks may not know is that, like what's so special about the blood-brain barrier? Like, how does that work exactly? And just to give a little bit of insight there. So my understanding of it is that our all of our endothelial cells, so the cells that line our blood vessels, they're connected by these proteins that are